Welcome. I'm Dr. Paul Smolin, also known as Doc Smo. I'm the founder of DocSmo.com, an educational resource dedicated to children and parents. Thank you for joining me today. So I'm guessing you're a little on the desperate side. You're searching around on YouTube and the internet because little Junior's got an ear infection and you got those expensive plane tickets to fly tomorrow and you want to know what to do. Well, I have some advice for you. You know our motto here, portable, practical pediatrics. Well, that's exactly what I intend to bring you today. In my 32 years of pediatric practice, I have found this is actually a pretty common situation where a child has a bad ear infection and their family is about to fly and they want to know what to do. So I'm going to give you the advice that I've given families, and it's worked very well for my patients. Well, first, let's review how your child's ear works under normal circumstances. Now, every time they take a breath through their nose, they equalize the pressure between the inside of their ear and the room around them. Their eardrum is happy, it's not being pushed, it's not being pulled, and there's no pain and there's no sensation. Eardrums are exquisitely sensitive to pressure changes across them. So if you're with an ear infection, the eardrum gets pushed outward and that hurts like crazy. The same thing can happen when the eardrum gets pushed inward, for that matter. So, but now your child has a cold and they can't breathe through their nose and they actually have an ear infection and they can't change the pressure inside their ear. They can't equalize it from the airplane around them. And as that plane takes off, the air gets thinner and thinner and the pressure drops and their eardrum wants to expand. The pressure around them is lower and the eardrum is like a balloon going up high. It's going to want to pop. And so the only thing you can do, the only thing you can control in this situation is to plug the ear airtight so that the pressure around them in the cabin doesn't want to expand their eardrum. And I'm going to show you how to do that now. It's really easy to do this. Okay, well, with the help of my little friend Serendipity, this is my little friend Serendipity, and we're going to assume she has an ear infection and she's about to get on an airplane and fly at 35,000 feet. And we want to keep her from feeling the pressure changes in the cabin, which are inevitable as you ascend. So I recommend that you go get some silicone earplugs. They're really intended for swimmers, but they're really great. And I've got some right here. And you just pull off a piece of the silicone earplug. They're very soft and malleable. They'll conform to the shape of her ear canal. And we gently put a piece in, enough. They'll fill up her ear canal and her outer ear like this, gentle pressure. And I think if it were me, at the same time I would do the other ear as well because she's got a bad cold and she can't equalize the pressure between her nose and her ears, and that's what we're protecting her from, feeling that pressure change in the cabin and having her eardrum expand on the way up and then get pushed in on the way down. You can also use Silly Putty, works very well as well in an emergency. And when you're done, you've got a toy for your older children. How great is that? So I would leave this in for the whole flight, as long as your child is not picking at it and there's no risk that they would choke on it. And then remove it when you arrive and you're ready to go. Well, for more practical, portable pediatrics, take a few minutes and explore the literally hundreds of podcasts, articles, and videos at my website, www.docsmo.com. If you have questions about your child's neck or any other body part, make sure you talk to that wonderful person you call your child's pediatrician. This is Doc Smo. Until next time.